Most indicative symptoms of type 2 diabetes. Diabetes, often called the silent killer, it strikes almost 24 million people across the U.S. Type 2 diabetes is the most common form of the disease, affecting approximately 90% of total diabetes sufferers. The surefire way to test for diabetes is by getting your doctor to perform a blood sugar test. However, the following 15 symptoms are indicative that you may have type 2 diabetes. 1. Recurring infections. Type 2 diabetes causes those suffering from the condition to live in an immune-suppressed state, which ultimately leaves them susceptibility to a variety of bacterial infections, such as yeast, or candida, infections, pneumonia, urinary tract infections, UTIs, and skin rashes. Basically, immunosuppression means that the immune system is unable to fight off infection. Yeast infections are among the most common because high blood sugar creates an environment that is favorable for yeast. Glucose is fuel for yeast. The more that's around, the more they can multiply, says Mary Kellis, MD, an endocrinologist at Cleveland Clinic to Women's Health. For the diabetic, infections are a constant concern since those suffering from the condition are more prone to developing infections due to high blood sugar levels wearing down the immune system and its ability to protect the body. Nerve damage, which also results due to low blood flow to the extremities, legs, feet, arms, hands, in some diabetic patients, can raise the risk of infection. 2. Increased urination. You may notice a change in the frequency and urgency of urination and your doctor may suspect diabetes. More frequent urination is often a wake-up call that you have an underlying health condition, especially if you are woken multiple times from sleep in the middle of the night with a bathroom emergency. Individuals with type 2 diabetes have overactive kidneys working to eliminate excess glucose in the blood, and the fastest way to eliminate anything from the body is through urination. Keep in mind that this increased urine output may not only keep you up at night, it can also cause dehydration, so be sure to hydrate. 3. Increased appetite. Unexplained hunger that comes in waves mimics the roller coaster of blood sugar highs and lows that a person with type 2 diabetes is suffering. A ravenous appetite occurs when blood sugar levels drop dangerously and the body demands glucose to function. Oftentimes, hunger pangs will rouse you at night and keep you up until you eat something. Experts from the American Dietetic Association recommend upping the healthy fat and lean protein content of meals, that is, nut butter, oil, avocado, raw nuts, etc., so that your body stays full for longer. Remember, you will burn through carbohydrates within a few hours, which is why hunger pangs are common mid-morning and mid-afternoon. 4. Unquenchable thirst. Excessive thirst often occurs with type 2 diabetes onset, signaling that the body is trying to replenish fluid levels lost due to more frequent urination, and sometimes, perspiration. As mentioned, it's common for type 2 diabetics to have overactive kidneys, which is how the body will try to eliminate excess glucose in the blood through urination. With increased bathroom breaks, the risk of dehydration is high, so be sure to hydrate regularly throughout the day. To make matters worse, many people don't realize they have diabetes, so they will try to quench their thirst with sugary drinks like soda or juice, but these just add to their blood sugar and make things worse, explains Gowden to Women's Health. Keep a water bottle with you and drink herbal teas rather than caffeinated drinks. 5. Exhaustion. Not only do increased blood sugar levels create an overall feeling of malaise, frequent urination, immune suppression, and a general sense of not feeling well, it will also cause extreme exhaustion. This general discomfort of all the other symptoms, plus the draining effects that excess glucose elimination has on the body, will suck away any energy and cause a person to feel like they need more rest. Remember, as the body flushes glucose from the body via urination, it's also flushing out vitamins, nutrients, and minerals from food before they can be absorbed. Let yourself rest when you feel tired to prevent an injury or to protect your already low immune system. Also, carbohydrates, which your body breaks down into glucose, are your body's main source of energy. But your body can't effectively use that source of energy when you have diabetes, writes Women's Health after talking to Perenni Gowden, MD. an endocrinologist at Boston Medical Center. 6. Sudden weight loss. Most of us would love to lose a few pounds here and there, particularly without much effort, but when weight loss is sudden and unexplained, it's usually nothing to rejoice about. It's often a sign that someone more serious is going on. Diabetes is one of the serious conditions that can cause sudden weight loss. It occurs when specific hormone levels become unregulated and prevent the body from getting glucose from the blood into the body's cells to use as energy. As a result, your body will begin burning fat and muscle for energy, which can often lead to sudden weight loss. This sudden weight loss can occur as a consequence of high blood sugar, dehydration, muscle breakdown and problems with your thyroid. Although this sudden weight loss is more common with type I diabetics, it can also strike type 2 diabetics several days at the onset of the condition. Because you're unable to get enough energy from sugar, your body burns your own fat and muscle for energy, says Kellis to Women's Health. Weight loss can be pretty significant, sometimes 10 to 20 pounds. The general rule of thumb is to visit a doctor if you have lost between 5 and 10% of your body weight in the span of only 6 months. 7. Mood swings. The glucose peaks and valleys experienced by type 2 diabetes sufferers will also leave you trapped on a never-ending roller coaster of emotion. When blood sugar is high, moods can be giddy and downright silly, but when blood sugar drops, mood can turn to irritable and downright nasty until energy stores are replenished with food. According to research from Diabetes U, type 2 diabetics run twice the risk of developing depression, more so for female patients compared to male patients. Luckily, several healthy lifestyle changes that proactively improve diet, physical fitness, health, and wellness are a good way to prevent and ward off depression and mood imbalances. 8. Slow to heal due to blood vessel damage from increased glucose in the veins. Type 2 diabetes sufferers often experience restricted blood flow, which causes a decrease in the time needed to heal surface abrasions, bruises, cuts, skin rashes, and infections. For type 2 diabetics, this slow rate of healing results from a lack of blood flow to the extremities. High blood sugars provide a good environment for bacteria to grow, says Bernie Gounden, MD, an endocrinologist at Boston Medical Center when talking to Women's Health. High blood pressure and high cholesterol are common in diabetics, which means there's more chance for plaque buildup in the blood vessels. This means that cuts, bruising, burns, and abrasions that occur on the feet, legs, knees, hands, and arms get lower blood circulating to those areas. Fresh blood flow to any area is the body's method to encourage the healing process. Another reason cuts are slow to heal on diabetics is because they have limited sensation. You're less likely to notice a cut because you can't feel it, which means you're less likely to take care of it and it's more likely to get infected, says Gounden. 9. Numb fingers and toes. Chills, inflammation, tingling, and prickly numbness in the fingers and toes are other symptoms linked to type 2 diabetes. This discomfort occurs when excessive glucose in the body causes neuropathy, or nerve damage. High blood sugars will weaken and damage the nerve fibers all throughout the body, but for diabetics, the nerves in the feet and legs are the most prone to damage. The effects of diabetic neuropathy are often reported as tingling, pain, or numbness in the extremities, usually the hands and feet, but can also extend to major systems and organs, that is, the heart, urinary tract, digestive system, and even the blood vessels. Diabetic neuropathy can range from mild to disabling and potentially fatal. If diabetes is left untreated, unfortunately this neuropathy can be permanent. 10. Vision problems. Eye vision is closely linked to blood sugar levels, which means when blood sugar drops, a person suffering from type 2 diabetes will experience blurred vision, floaters, and even light sensitivity. Luckily, once blood sugar is stabilized, vision will return to normal as well. But leaving blood sugar unbalanced for too long may permanently damage vision. Diabetes-related eye issues develop when the condition is left untreated because vision problems are directly linked to blood sugar control. That means in managing blood glucose, eye issues will reduce for the diabetic. According to a United Kingdom prospective diabetes study, published by Diabetes UK, The threat of glaucoma and cataracts is double for diabetics versus the general population. Both conditions can lead to blindness if blood sugars are not managed properly. 11. Strange smelling breath. We already talked about how diabetes leads to dehydration, which causes an unquenchable thirst and a dry mouth. Well, this also leads to bad smelling breath. When the mouth is dry, there is no saliva to wash away the bacteria and balance out the pH in the mouth. Undiagnosed or uncontrolled diabetes can trigger ketosis, a process in which the body uses fat, rather than glucose, or energy, explains Women's Health. Ketosis releases a chemical byproduct called ketones, which can make your breath smell unpleasantly sweet or fruity. It could even smell like acetone, which is a type of ketone, says Mary Kellis, MD, to the source. If you notice that your breath is beginning to smell strange and you're not on a keto diet, then you should consult with a doctor to find out what's causing this change. 12. Dark spots on the skin. Keeping a watchful eye on any changes to our skin is something we should all get in the habit of, particularly when concerning skin cancer. But there's also another reason we should be watching our skin closely. Dark spots on the skin, which often appear on the neck, under the armpits, or even in the groin area, are a common early warning sign that a person is resistant to the hormone that regulates glucose in the blood, which is a precursor to diabetes. The medical name for the condition is acanthosis nigricans, AN, writes Women's Health. We see this often in women with polycystic ovary syndrome, PCOS, says Mary Kellis, MD, an endocrinologist at Cleveland Clinic, to the source. Women who suffer from PCOS are at a higher risk of developing diabetes and are often found to have issues with the hormone that regulates glucose in the blood. Keep an eye out for any dark spots on the skin, and if any are found, consult with a doctor. 13. Feeling itchy. There are many reasons that our skin can begin to feel itchy, but when it comes to diabetes, it is often due to dry skin, poor circulation, or even yeast infections, which surprisingly, can also occur on the skin, says the American Diabetes Association. You'll know if the itching is as a result of poor circulation because the itching will be localized to the legs, notes Women's Health. According to health.com, the itchiness could also be from fluid loss due to frequent urination, plus poor circulation and nerve damage due to thick, sugary blood can dry out your skin, especially on your lower extremities. The American Diabetes Association suggests people with diabetes who are suffering from itchiness to limit their bathing time, particularly in less humid climates. You should also use soap that contains moisturizer and apply moisturizer immediately after bathing. 14. Gum disease. Inflamed or infected gums can be another strange sign of type 2 diabetes, according to health.com. While these symptoms are actually a sign of gum disease, often referred to as periodontitis, research published in the journal BMJ Open Diabetes Research and Care found that it can also be linked to type 2 diabetes. The study found that people with gum disease, especially those with severe cases, had higher rates of diabetes, both diagnosed and undiagnosed, and pre-diabetes than those without. Write health.com. The connection between diabetes and gum disease can go both ways. They could both equally be responsible for causing the other. Both increase the risk of developing the other. Inflammation caused by gum disease acts on the same factors that are responsible for high blood sugar that cause diabetes, says Ronald Tamler, MD, Director of the Mount Sinai Clinical Diabetes Institute, to health.com. 15. Emergency symptoms of type 2 diabetes. Now that we've listed all the early warning signs and most common symptoms of type 2 diabetes, let's talk about some of the emergency symptoms. Diabetes is a serious condition as high blood sugar can cause long-term damage to the body. At the same time, so can low blood sugar, also known as hypoglycemia. For people with type 2 diabetes, only those who are on medications that increase the body's hormone that regulates glucose in the blood levels are at risk for low blood sugar, writes Healthline. The source goes on to list the emergency symptoms, or hypoglycemia symptoms of type 2 diabetes, which include shaking, dizziness, hunger, headache, sweating, trouble thinking, irritability or moodiness, and rapid heartbeat. Any diabetic who is on medication that can lower their blood sugar should know how to treat the symptoms associated with hypoglycemia, says the source.